If you have been to the emergency department lately, you may have noticed some overcrowding and longer than normal wait times. Tonight, WRAL investigates, asks the reasons why.
As the Triangle's population grows, WRAL's Joe Fisher reports hospitals are feeling the strain.
We've been hearing about these long wait times at the ER for months. Right now, hospitals remain full, and medical professionals tell me unless you have a true emergency, you might be better served at a primary care or urgent care office.
It was just really busy.
When Iris Smith's 81-year-old brother got sent to Wake Med for internal bleeding in January, he spent 3 days in the ER, even after surgery.
When he left from the emergency room. He never got a bed. It was overwhelming. I mean, I just felt so sad for the patients, for their care. And it was just shocking.
And just last week, another family member got treated in a hallway.
All the bays were filled up.
Triangle hospitals post-COVID are struggling to find staffing and space.
The hospital remains full.
Wake Med Vice President Dr. Seth Brody says sicker patients and population growth is putting pressure on resources.
There are just a lot of patients for a lot of reasons, and the acuity, meaning how sick they are, is also higher.
When hospital beds are full, it leads to backups at the ER. It's also taking longer to discharge patients, with wait times increasing for nursing homes and rehab centers. It's forcing hospitals, including WRAL, to be flexible.
If we don't have capacity, well, then we have to create capacity. Maybe it's repurposing an area of the hospital that is not used as much for and using it for an observation space for patients.
Ambulances are also waiting at the ER.
Post-COVID, it has been worse.
WRAL Investigates obtained records from Wake EMS showing the average turnaround times for ambulances at local emergency departments. Wake Med Main had the highest at 46 minutes. Wake Med North, Wake Med Cary, and UNC Rex averaged 40 minutes, and Duke Raleigh 38 minutes.
There's nowhere to put the patient at times and no staff to take the control of the patient.
At Wake Med, records show from January to March, nearly 900 calls took more than an hour to offload the patient. 44 calls took more than 2 hours, and 9 calls over 3 hours.
It's a domino effect. If our crews are out of service at the hospital with a patient on the bed, they can't answer 911 calls.
Patients' families say the overcrowding should be sounding alarms.
To me, it's unacceptable.
And hospital beds are licensed by the state, so it's not as simple as just adding beds. Meanwhile, there is concern about staffing, and many in the medical field will tell you that this overcrowding makes hospitals, especially emergency departments, less attractive places to work. I'm Joe Fisher, WRAL News, Raleigh.